Right, so tell me about the treatment today. So what are we getting done?
So today, what we're going to do for yourself, Marshall, is that you're concerned about the loss of volume under the eye area.
Yeah.
You feel that the skin is sagging a bit here.
Okay.
And you've got a bit of darkness up here as well.
All right.
Now, so the plan of action today is the first thing that we want to do is restore the lost volume.
Okay.
When we're young, I call this area the fountain of youth.
Okay.
We lose this fat pad, which naturally, it did a lot of things that was in here. It helped keep this up, it gave volume to that area, it gave texture up here. So this is a very scientific injection of a filler to replace this lost fountain of youth. Nobody knows you've had it done.
Okay.
Because it's not obvious, because it goes deep down. It's a very scientific or a very technical injection, but you do get a second look. You're looking fresh,
Okay.
and that's the idea. Secondly to that, what we want to do is work in the tear trough area up here where you have lost some volume and pop some filler in there. And that filler that I like to use is one called Teosal Redensity. And what that has is it also has some rejuvenating ingredients in there which help rejuvenate the skin. Now, once we've done your tear trough filler to that area, that will help the sort of volume and the appearance, but it will not take away the dark circles. For that, we will get you back in, and we have a special dark circle protocol, which involves a skin analysis, a scan, assessment of your pigment, assessment of your blood supply, assessment of the skin tone, the texture, and for that we use a combination of lasers, peels, mesotherapy, RF needling. We've got a very bespoke program that restores all these things.
Okay.
So today what we want to do is we want to do a bit of restoration of the volume in that area.
Fantastic. Just putting it in, a bit of a flat. And if you just sit up a second for me, please. And sit back. Excellent. We've got some lovely revolumizing in this area. Okay.
And now the inner area here is where I'm going to use a finer filler in there, okay? We can't pop that in with a cannula, but because of the depth, you've got very masculine facial structure with deep cheekbones. So I might actually do direct injections rather than using a cannula in your case.
That's fine.
That's very nice. So Marshall, what we've done is we've done a treatment along this side and that side. Do you see the difference already?
Yeah. I can see that the pockets look more full.
So what will happen is over the next 2 or 3 days, that's going to increase in swelling. And then after about 4 or 5 days, it starts to come down. And after about a week, you think, gosh, has he even done anything? My eyes are looking the way they are. Don't panic, because after 2 weeks, it will start to fill up again because it then starts to attract water.
Right.
And by 4 weeks, we're at its final results. Now with tear trough, it's very common that you have a second treatment after 4 weeks. 50% of people don't need a second treatment, but a lot of males will, because particularly when you've got deep orbital pockets in there. But that is a pretty good going result.
Yeah, it's all here, isn't it? All that. Yeah, great. Yeah, I love it. I think it's really good. I can see the difference. I mean, wow.
Yep. Now you've had a thorough analysis.
Thank you.
Pleasure.
Really appreciate it, Dr. Ahmad.
Thank you.